Thank you for joining us for today's Ipsos webinar featuring strategic insights from the Patient Experience Survey, a study conducted in partnership with Pharma. Today, we are pleased to welcome guest speakers from Pharma, whom you will meet shortly. So now, without further ado, it is my pleasure to welcome today's first speaker, Chris Mosner, Senior Vice President with Ipsos's Public Affairs Practice. Chris, you have the floor.
Thank you, Ellen, and thank you for the nice introduction. And thanks to each of you online who are joining the webinar. The webinar today is designed to share some really important information, data, and findings around the Patient Experience Survey that Ipsos has partnered with Pharma on. In a moment, I'm going to introduce two of our guests who are going to be talking about the data, but I want to reiterate a couple points that Ellen just made. The survey, or excuse me, the webinar is being recorded, and we'll send out that link in a few days, as well as the presentation deck that we're going to share that shows a lot of really important data that will be attached to that email as well. And we will do our best to answer questions in the moment, but we will respond to them by email as well. So let's talk about our two guests. First, I'm going to introduce Cynthia Hicks. She's a Director of Insights and Public Affairs at Pharma, and in a few minutes, she's going to highlight the key findings from the most recent PES study that was conducted. I will take a moment right before she speaks to talk about the methodology and the sample source used for the study. But we're going to start with Sharon Lamberton. Sharon is the Deputy Vice President for State Policy and External Outreach at Pharma. And she's going to provide an overview and backdrop for this important data set and really how it describes the American experience. So with no further ado here, Sharon, why don't you take over and give us a little bit of overview of what we're going to be talking about today.
Well, thank you, Chris. I really appreciate you and Ipsos for hosting this event and for all of you who are attending. I know it's a busy week after Labor Day, but we think you're going to find this presentation interesting and hopefully helpful. Before I start today, I'm going to the next slide to set the stage on why we're here. These are three things that we're seeing in the states where I work in state policy and on the federal level, and more importantly, what the Ipsos polling that you'll hear my colleague Cynthia talk more about. The three trends and common threads seen are that there's an increasing influence of insurers and their middlemen and how it's impacted patients, specifically how they're experiencing the healthcare system and able to navigate it. Number two is that patients are still having issues affording and accessing care that they need. And third, there's a need to move forward, and policy solutions are required by all stakeholders so that Americans can get what they need. As we transition to the next slide, I want to tell you a little bit about myself. I've been at Pharma, the trade association of 30 drug companies that make brand name medicines and treatments, for about 21 years. Before working at Pharma, I worked in direct patient care at National Institutes of Health in the clinical center in Bethesda, Maryland, working in neurology. And I was seeing firsthand what a clinical trial was. I was working with clinical trials and bringing drugs to market along with the private sector. And now, full circle, I'm working to protect those medicines and the innovation that's needed to bring more treatments to market. And I say that because when I did work at NIH, I worked on it with 30-year-old males that had, for just an example, they had an interesting condition called Gaucher's. It's an accumulation of lipid or fatty substances in their organs that ended up killing them. It was a rare hereditary disorder, but it was amazing to see a medicine save their lives, Cerezyme, which now is on market. Now we see so many examples of innovation. We've seen in just neurology, Alzheimer's treatments now, the first multiple sclerosis oral treatment, no longer only infusible treatments. We have other things like type 1 diabetes treatments. We've had, of course, the COVID vaccine come to market in less than a year, and treatments that saved over 2 million lives and 17 million hospitalizations, and the list goes on. So I'm really hopeful about innovation. But this slide kind of drives home the risk and the expense of bringing a drug to market. I did not realize that it took truly 12 to 15 years to bring a drug from bench to bedside. That's going through phase 1 through 3, and it cost an average of $2.6 billion. Of those medicines that start at phase 1, 88% fail. That's an extremely high failure rate. And for vaccines, it's 95% fail. So it's important to have policies on the state and federal level that will support innovation for our patients, for our family members that are waiting for these treatments that are still needed to improve and save lives. So when I do talk about the context of research and development, we have had some incredible advances. We had 55 new drug approvals by the FDA alone just last year. We have 8,000 medicines in the pipeline, 5,000 of which are here, right here in the United States getting developed. So we have a lot of hope, but we need to have the environment policy-wise to support the innovation that our companies need to continue the important innovation, or it will not continue. And why this is so important, you'll hear in a moment, but I want to go through some of the factors I see. After I left NIH, I began working with senior organizations on policy and then worked at pharma for 21 years. And I'm now in the States working on state policy, testifying at state capitals on important policies that do support this very innovation I talked about. I also hear from patients and providers the struggles and the need. One size does not fit all for medicines. We know we need a variety. So the first trend on the next slide that we're going to turn to shows one of those trends that I'm seeing on the state level and that you should be aware of that are impacting how patients are experiencing their health care today. When I said at the outset that the negotiating power is increasingly concentrated among a small number of PBMs, 3 pharmacy benefit managers comprise 80% of the market share, or 80% of covered lives are covered by these 3 PBMs. Why do I say this? This is important because of those, 2 of those 3 PBMs are in the top 10 Fortune 500, and more importantly, they have very important negotiating power. They determine what goes on the formulary, what tier a medication is accessible, or does the medicine get on a formulary at all. Next slide is important to look at as well. This is a slide that's been used in Senate hearings very recently. You've probably seen this, but it is talking about how important it is to see that vertical integration is occurring. What do I mean when I say that? It means there are some misaligned incentives. The insurers and the PBMs and provider services often are all in one. It's something that our congressional folks on the federal level have looked at. There's multiple bills on the state level, over 30 bills on pharmacy benefit managers and looking at how we can work to get some of that savings that the middlemen get passed on to the patient. We've seen 3 bills in states that do that very thing. In West Virginia and in Arkansas and Indiana, we're seeing that money that would normally go to the middleman go to the patient to help them afford their medicines at the pharmacy counter, but that's an important trend. The next thing we want to talk about is the next slide here, is showing that PBMs insurers are unfortunately excluding a number of medicines from formularies. We just talked about how risky and expensive it is to bring a medicine to market. When you do get that green light as a manufacturer and you get that green stamp of approval to go forward and get that medicine out to the public that need it and to the providers that need tools to treat their patients, how frustrating is it that we just saw this Xcenda study in 2022 that showed 1,156 medicines have been excluded by the top 3 PBMs. The next slide shows, in addition of those medicines, it's for some of the most vulnerable patients. You see cancer patients, rheumatoid arthritis patients, neurological patients that suffer from MS. These are patients that can't, they know what works. They failed on medications and hopefully found one with their provider that does work. But when you have additional barriers where they're not even putting it on the top tier, they're just plain not covering it, that's a true barrier for patients. And as you'll hear from my colleague Cynthia, this is truly what was found in the polling as well. So it's not just data and studies and what I hear in the states and what I'm telling you about hearing at federal hearings. It is actually substantiated with this important Ipsos survey that you'll hear about in just a few minutes. But this is important to me. As a nurse, I do not want my patients, like for example, chronic myeloid leukemia, CML patients, cancer patients, that over 52% of CML patients are subjected to utilization management in the commercial market. That might mean they have to fail first, or there's a step therapy, or there's something preventing them from getting the medicine that their provider feels they should have to give them the greatest success. We don't have time to fail, especially our cancer patients. So this is a critical study to look at the phenomenon. And again, it makes sense when you hear the polling data that you're going to hear in a few minutes, how this does come together. Next slide. We also see patients with some of the highest cost sharing are more likely to abandon prescriptions. And what do I mean by that? We know that 3/4 or 74% of patients that have prescriptions that are $20 or less. But if that prescription goes up to $250 out of pocket cost, 61% of patients won't fill it. We do not want patients to abandon the medicines at the pharmacy counter. It'll result in increased ER visits, hospitalizations, and just bad outcomes. But we know when patients use prescriptions as intended and as instructed, you can save tremendous amount of money. There's an estimate that we, the federal government and the states, could save over $213 billion a year if medications were used as prescribed. My son has asthma. When he uses his asthma inhaler, when he's doing football, or when the weather changes during two critical times of the year, usually October and tax season, he's going to need that inhaler. If not, he misses school, I miss work, costs go up. So we know without a shadow of a doubt that medications, when used appropriately, can improve outcomes and bring down costs. But when the costs of the cost sharing, where the patients are paying higher deductibles, higher co-insurance for their medicines are too high, they'll just abandon it, and that does no one any good. The next slide is my final slide, but it's so important because when you hear about the patient experience survey that you'll hear Cynthia talk about, it truly served as a compass for pharma. We have 5 main policies that I've listed here that we are working on in the state through various pieces of legislation. And these are things that will help the patient afford their medicine and access it at the pharmacy counter. It'll bring down their costs so that they can have better health, and it'll bring down costs for everyone, including employers and states. And this polling information truly helped serve as a guide to show that we were truly in alignment with what Americans are experiencing. The first one briefly is share the savings. Again, I mentioned that earlier, where 3 states have passed this critical legislation where it just simply says that a portion of the 50% of spend on medicine that typically goes to middlemen should go to the patient at the pharmacy counter. That will help them afford their medicines. That's passed in 3 states. It was active in over 18 this past legislative session. We expect more this year and hope to see more relief. Making coupon count. What does that mean? It means the manufacturer assistance that is provided to patients should count to reduce their out-of-pocket deductibles. That's so important because there are some tools that are used by plans that prevent patients from counting manufacturer assistance toward their out-of-pocket deductibles. That's accumulator adjustment programs. We want to see that banned. It has been banned in about 18 states, and we hope again to see more of that, because patients should be able to count that assistance toward their out-of-pocket deductible and prevent surprises at the pharmacy counter mid-year. And then finally, cost-sharing solutions covering medicines from day one and capping patient cost sharing are all additional policies that you will see culminated from a lot of what you're going to hear Cynthia talk about with this patient polling, this patient experience survey. So you've seen a lot, whether it's Commonwealth, you've seen a lot of polling, I'm sure, but this is an important poll that has very similar data, but really gets down to a granular level I have not yet seen on what patients are experiencing, which is what we are all here today for, is how do we get patients relief? How do we get them their medicines that they need and the care that they deserve? Thank you, Cynthia, and we'll talk in a minute, but I'm going to kick it over to Chris to talk about this survey and how it was structured. Chris?
Great. Thank you, Sharon. You talked about that there's a number of surveys that are out there that talk about some of these issues. And our particular survey, I'll talk a little bit about methodology before I kick it to Cynthia, but we did an extensive literature review around the existing and relevant academic studies that are out there to inform our questionnaire design. And we thought about how patients are experiencing the system right now, but we also went deeper to understand also in some of the issues that they're dealing with from a practical level, as well as pricing, et cetera. So the survey was conducted in April of this year, including, utilizing Ipsos's probability-based knowledge panel. Now, the knowledge panel is the largest nationally representative panel of the adult population in the US, and members are recruited using a probability-based, address-based sampling methodology. So this is gold standard. This is not cheap sample. There's no shortcuts taken in this kind of work. In order to maintain full representation of all adults, part of our methodology is for those households without internet access, we provide them with internet-enabled devices as well as an ISP so that they can participate in important surveys where they generally are not reached, whether it be by mobile phone or telephone. So we are really, we stand behind this survey. Let's talk about sample sizes for a moment. So the survey was based, again, on a nationally representative sample of over 5,000 respondents aged 18 and older. And this also included 4,800 respondents who were reported as insured, as well as 3,400 insured respondents who reported taking prescription medicines when we were doing the survey. So very deep. The survey was also fielded in both English and Spanish to allow respondents to respond in the language most comfortable to them. And I would also make one last point, is that this survey instrument, and with the representative sample that we have, really are in line with the other large-scale surveys that you see reported out, whether it be the Kaiser Family Foundation or Pew Research Center, among others. So we're talking about gold standard sample. We're talking about a depth of questionnaire that touches on all issues, and we're talking about a sample that allowed us to see differences among those who were insured and those who were not, and then also those who were taking prescription medications or not. So Cynthia, I'm excited to pass it to you to share some of the data highlights. Let's go to the next slides here.
Wonderful. Well, thank you so much, Chris and Sharon. And as Sharon alluded to, the reason behind this research investment really for us was to make sure that this study did inform that public policy debate. So as Sharon said, really serve as a compass for us And we wanted to make sure that we did that with the most rigorous data on the patient experience. And since we started this thought leadership series back in 2021, what we've kind of noticed time and time again is that oftentimes the debates that are happening on the Hill or at state capitals don't always match some of the kitchen table conversations that so many folks are having. So that was really important for us to really take a look and narrow in on those conversations and really highlight what the pain points are for Americans in their patient experience. So if we can jump to the next slide. Our latest wave that we just conducted really put a spotlight on 3 different things that we're going to cover today at a really high level. The first one that we really focused on was cost barriers in the patient experience. What we really find here, and we'll talk a little bit more about this, is out-of-pocket costs. So we see that 1 in 5 say that their out-of-pocket costs are simply more than they could afford. So the cost barriers are definitely something that are really impacting folks. In addition to that, there are barriers to access. So there's coverage barriers. What we find in this wave is that 4 in 10 insured Americans face some type of insurance barrier, things like prior authorization, step therapy, that are really impacting their access to the care and the medicines that they need. So we have these cost barriers, we have these access barriers. We also, within the survey, wanted to talk and just discover a little bit more about how to fix these things. And what we find in our survey is that Americans overwhelmingly support solutions that are very concise, that are very direct, and very patient-centered. So folks want solutions that address the first 2 problems that I just spoke about, having more predictability when it comes to cost, more transparency, overall fairness in the system and the coverage that they have, and policies that would really target and help address the high out-of-pocket costs that they're facing. So these are really some of the conversations that we're hearing, not only in this survey, but in other focus groups that we're doing. So we really wanted to make sure to cover these today. But I will go ahead and unpack a little bit. So if we can jump to the next slide. As a context setter, before we dive into some of the other data points, I wanted to show these 2 data points, which I thought was a really good example of the puzzle that we're trying to unravel with this patient experience survey. So as you can see on the left-hand side, we find that 93% of insured Americans agree with the statement, insurance should work for everyone by providing affordable access to healthcare when it's needed. So most folks agree with that. If you look on the right-hand side, you see that about 1/3, so only 1/3 of insured Americans believes that insurance currently is providing everyone with affordable access to healthcare when it's needed. So this is a puzzle that we're trying to unravel, this gap between the expectation that folks have, like folks believe insurance should do this, should work for everyone, and only 1/3 think it's actually doing that and meeting that bill. So, and we're not the only ones that see it. Recently, Commonwealth Fund had a study where they saw that 25% of the public are in fact covered, but underinsured. So I think the bottom line here is that it's not enough to have coverage. What we find here is that folks are really in need of good coverage that really works for them and meets their expectations. Next slide. So to take a step back, how we started the survey is we asked respondents very broadly where they stood on healthcare priorities. So we asked, what are the most important healthcare issues to you? And what we see here is that the front runner, the top result that we have is out-of-pocket healthcare costs. So things like deductibles and co-insurance, really leading the pack here, followed by the cost of health insurance premiums and inefficiency and bureaucracy in the health system. A little bit lower tier, you'll see things like the cost of hospital services and the cost of prescription medicines. Overall, what we see here is that costs are a huge concern, but I will note that we asked this type of question numerous times in the survey, and in all of the different ways that we asked it, we continue to see that out-of-pocket healthcare costs rose to the top. It's definitely a big concern that we'll dig into a little bit more in detail. So if we jump to the next slide. Here's just another example. We wanted to put healthcare out-of-pocket costs into some broader context. So what we did is we included this along with a lot of other type of expenses. So as you can see here, we have things like monthly groceries, transportation, and the question was, how concerned, if at all, are you with your ability to afford the following? And we see that even when we open this up to other types of expenses, out-of-pocket healthcare costs are still a leading concern for insured Americans. So again, just another example of that top priority and that true pain point that this is for many Americans. Next slide. What we find here is out-of-pocket healthcare costs are something that are very deeply felt. So even with insurance, despite having insurance, we find that 1 in 5 Americans still feel that they're unable to afford their out-of-pocket costs. And what you can see on the left-hand side is that this doesn't affect all Americans. You see that 39% do find that their out-of-pocket costs are affordable. 39 say that they're expensive, but they're manageable. It's that 19% at the very bottom. My out-of-pocket costs are more than I can afford. Those are really the folks that we wanted to make sure that we really looked at and understood. So as you can see on the right-hand side of the slide, you'll see some of the folks who disproportionately, some patient populations that disproportionately felt the burden of out-of-pocket costs more than others. So you see groups like women, Black Americans, Hispanic Americans, caregivers, and then rural Americans actually jump off the charts. 38% of them self-report that their out-of-pocket costs are more than they can afford. And I just really want to underscore the fact that these are all folks with insurance that are stating these. So it's definitely something that we want to continue to monitor as we do more waves of this study. Next slide. So what kind of out-of-pocket costs? We really wanted to understand the main drivers of this out-of-pocket cost burden. And what we see here is that most, 39% of insured Americans cite deductibles as the main reason why it's difficult for them to afford their out-of-pocket costs. Again, this is not just us. We see Kaiser, Consumers for Quality Care, a lot of other third-party sources are really looking at and identifying deductibles as a true pain point for folks. Just so you know, in our study, we found that 26% have a deductible over $3,000, which to many families, that's just simply unaffordable and really, really taxing. So it's not a surprise that deductibles are such a huge issue, but it's definitely something that we want to continue to monitor and continue to see what the trends are like as we move forward. Next slide. And this is another kitchen table conversation, and I know that this has been on the news. Even this morning, I saw some articles and some studies about the true problem when it comes to medical debt in this country. And we see that too many insured Americans are saddled with medical debt. In our PES study, that number is 17% who self-report, yes, that they do have some outstanding medical expenses. I believe the Federal Reserve, this number was about 16%. And then the Consumer Financial Protection Bureau estimates it's between 18 to 35%. So obviously, a lot of different folks are looking at this very important issue. And we see that it disproportionately affects certain patient communities. Again, so we see that Black Americans, those with a household income less than 75K, chronic disease patients, disproportionately report having medical debt more than others. So definitely in terms of health equity and really looking at that, it's something that we find really important and are continuing to look at ourselves. In terms of the source of the medical debt, within our survey, we also asked where this medical debt is really coming from. And as you can see on the right-hand side, primarily we see that it's coming from hospital bills, doctor bills, and then a little lower tier, you'll see things like dental care, prescription medicines, and the like. So again, this is bottom line, millions of folks are dealing with this. And what really stood out to us were the groups who were facing this more than others. Next slide. So we went over a lot of different affordability challenges that Americans face. And what we found within our survey is that it's not just, it's not just these affordability challenges that are affecting folks in a real way, but it's also affecting their future outlooks, how they really feel about the healthcare system moving forward. So these are just a couple of different examples of some of the questions that we asked. We found that 53% say that they can't anticipate what they'll pay for healthcare services, even if they're covered. 41% say that they have trouble navigating their health insurance coverage. So again, there's just this hesitation with even navigating the coverage that they have. On the right-hand side, you'll see that 39% say that they are not optimistic about affording out-of-pocket costs from a hospital or ER visit, and 34% are not optimistic about affording healthcare out-of-pocket costs in total. So again, when we're looking at this data, some of those who are having a harder time navigating their insurance are younger, those with a lower household income. And so these are really important attitudinal and outlook type of questions that we really thought were important to include within the survey, because this is how they view the healthcare system. And we really want to continue to see how this trends and how hopefully policy solutions can help here. Next slide. So switching gears, we talked about the first portion of it, which were these cost barriers, these affordability challenges that folks face. If you can get past that, you have a different set of barriers, as you can see here on this slide. We find that nearly 4 in 10 Americans face some type of insurance barrier. So when I talk about insurance barriers, it's things like prior authorization, waiting to get prior authorization before you're able to use a medication, things like formulary exclusion. And I know that Sharon also touched on these things. This list is very specific to insurance barriers when it comes to accessing your medicines, but we've also seen some external studies that have these types of insurance barriers writ large, and we see that that 38% number actually climbs much higher. So it's definitely something that we're keeping an eye on, and especially with prior authorization and formulary exclusion being really those top ones that folks are experiencing over the past year in terms of access barriers. Next slide. And a sobering and sad fact is often these types of insurance barriers may lead to non-adherence, so folks not taking their medicines as prescribed. So our study finds that 34% in the past year have reported having some type of adherence issue, things like skipping a dose or cutting pills in half, and 17% reported multiple adherence issues within the past year. So fairly big numbers. As you can see on the right-hand side, the top issues that were selected were skipping doses, delaying pickup, or taking medicines. We also find when it comes to adherence, there were some groups where they faced adherence issues more than others, and those were groups with chronic conditions, household incomes below 75K, younger Americans, so 18 to 44, and also rural Americans. So those are just a couple of groups that really stood out to us in terms of those who unfortunately face the most adherence issues. Next slide. And lastly, the final section of our survey really tries to answer the question of, what do we do about this? How do folks feel about this? So before we got into very specific policy solutions, what we did is we asked a series of attitudinal questions just to kind of get a lay of the land of how folks felt overall about their system. And what we see here is that largely Americans want more accountability in healthcare. So some themes that popped out and that we wanted to share with you all today were the patient-provider relationship and how important that was to folks. As you can see here, 93% of insured Americans agreed with the statement, doctors, not insurers, should determine the prescription medicine, whether prescription medicine is appropriate. So again, we saw this various times in different types of questions, that doctor-provider relationship, making sure that those were the decision makers, not anyone else, was so important to folks. Some other themes that we saw in the data were around transparency, making sure that other actors in the system were transparent, that it wasn't opaque, that folks felt like they weren't in a black box. And then other themes like fairness. 88% of folks agree that it is wrong that I pay more than my insurer or my PBM. So just a general idea of not wanting to pay more than their insurer. So definitely themes of fairness, transparency, and that doctor-patient relationship really resonated within our survey instrument. Next slide. And then more specifically, we did ask a question around specific policy solutions, and we found that there was overwhelming support for solutions that were very meaningful, very specific, and most importantly, lowered people's costs. So as you can see, we have pretty high support across the board here, just a couple that we wanted to flag with you all. But 90% of insured Americans support requiring hospitals to be more transparent on markups. So again, this theme of transparency. Same with 90% wanting to ensure more predictability to no cost. So transparency, predictability, really important for folks. They want that addressed by their policymakers. 89% support requiring insurers to pass on prescription drug rebates at the pharmacy counter. So again, this is something that I think Sharon alluded to at the very beginning. We see widespread support within our survey instrument as well. And other things like ensuring that copay assistance counts towards a deductible, making sure that any discounts are used for the patient's intended. These are all widely supported. So this is really encouraging and also validating data that patients really want very concise and very specific reforms. It's not like the whole system is broken, but some improvements and some adjustments that are very patient-centered would really go a long way and are very supported by the Americans that we have polled here. So if we can jump to the next slide. So I know that was a bunch of data in a very short period of time. Like Chris said, it was a very rigorous 5,000 person survey. So there's plenty of more data in our full report. So here we included links to all of our resources on the Pharma site and also on the Ipsos site. So if you want to dig into the full report and other pieces of collateral, you're more than welcome to. We'll make sure to include this in the follow-up. And if we jump to the next slide, we actually have the links for our 3 previous waves. So you can kind of see different trends that we're picking up on since the very start of the patient experience survey. So with that, I will pause and I will kick it back over to Chris for some Q&A.
Great. Thank you, Cynthia, for sharing. You was a bit of it's a fire hose of data, but it's really important to understand where people are and how they are dealing with things. So I've been taking notes of the questions that have been generated by those people who have been enjoying the webinar today, and there's a couple consistent themes. So I guess first for you, Cynthia, much of the data here speak to kind of the issues and concerns about coverage, yet we hear so much about the prescription drug costs, right, in the media and from policymakers, et cetera. Can you give me a sense of why that is?
Yeah, of course. It's a great question. And I think in terms of the data, and I'll let Sharon piggyback as well. In terms of the data, we did ask various questions, I think you saw in some of the slides, around the costs of prescription drugs. And what we found consistently is that they were lower tier, kind of at the middle or lower tier on our list. However, what we kept seeing over and over again is out-of-pocket costs. Out-of-pocket costs once again. So I think what we're seeing, at least in the patient experience survey, is that issues related to coverage and the cost of coverage, such as out-of-pocket costs, continue to rise to the top. And we know that the cost of prescription drugs is a serious issue and that affects many, many people. But I think our presentation really just tried to hit on the point that insurance is not working as it should, because that was such a consistent theme that we saw throughout so many different questions. But I don't know, Sharon, if you wanted to add anything else.
No, I agree with that. And what I hear in hearings, or whether I'm talking on panels, patients are having trouble affording their care, but a lot of that is because of what you just said. The insurance that they have, that they've been paying for, is not working like it should. Insurance deductibles have increased 50% since 2014. It's becoming unaffordable. And if we look at the benefit design, it needs to change. And one of those policies I recommended, which is sharing the savings with the patient so that the patient has some relief at the pharmacy counter, would help. So manufacturers provide a number of rebates, about 50% off of what is list price or sticker price of a medicine, and just a portion of that rebate going to the patient would help. We have a study that shows that it would only increase premiums less than 1%. It should be done. It's been done in 3 states, and it's a quick, meaningful way to get patients help.
Okay, I want to be a good time manager. I have 2 more questions, kind of broader questions that have come through. The first is, what do the data tell us about health disparities? Where or among which groups are you seeing the most significant disparities?
Yeah, that's a great question, Chris. And I know throughout some of the slides, we showed a little bit of that, some call outs, but where we saw it, and the report goes into a little bit more detail, is in a couple of different places. So in terms of affordability and out-of-pocket costs, we see within this wave, Black and Hispanic Americans disproportionately are burdened by out-of-pocket costs. We saw that on one of the slides that I shared. We see it across the many different ways that we ask about out-of-pocket costs and that burden. So those are some groups that I would flag there. We see that for Black Americans, they self-report medical debt disproportionately more so than others. So that's definitely one flag there. And then things like utilization management, insurance barriers that we covered, we see that we see kind of an uptick there among chronic disease patients. Sadly, those who need it the most. Younger Americans, we saw 18 to 44, we saw some differences there, as well as the LGBTQ plus community in terms of those access barriers. And then finally, I think we covered this towards the end very quickly, but when it comes to adherence to medications, we see that those groups who are facing that disproportionately more so are younger Americans, 18 to 44, those with chronic diseases, and then rural Americans. So definitely, and this has been very consistent with previous waves that we've done. Communities of color have really disproportionately faced these affordability concerns. It's something that we've seen wave after wave after wave. And when it comes to these access barriers, chronic disease patients, and then I'll also flag that rural Americans, really, that was something that we flagged with this fourth wave of the study. Consistently, we were seeing them kind of leap off the charts. So that's definitely a group that we've been taking a look at there. But I think overall, one of my favorite parts of working on the patient experience survey is taking a look at, this. Unfortunately, there's a lot of implications on health equity here, but I do think that this is really helpful data that hopefully will help impact some change. But those are just a couple of the disparities that come to mind.
Okay.
I would just add, if I could, Chris, just briefly to what Cynthia said, Pharma does a lot of work on health disparities. And it's good that 800 of the medicines in the pipeline are actually for racial and ethnic communities that are diverse and patients of color. But aside from the innovation and medications we're bringing to market that will help those communities, we know that sharing their savings or passing on some of those rebates helps those very communities. We have a study that shows adherence improved 19% for Hispanics and over 16% for Black communities when you share just a portion of those savings. So again, what are the policies that are going to help these patients that tend to have more comorbidities and worse health disparities get the care they need?
Thank you. So Cynthia, last question. There are a lot of public polling out there on this issue. We do some of it, other pollsters do the same around patient experience. So how are these results comparable to what you see out there in the media and in other large scale reports?
That's a great question. Honestly, it's quite encouraging to see a lot of these publications coming out with similar findings. It helps validate ours, and it also kind of speaks to the commitment overall of the research community on looking at these important issues around the patient experience. So I'll say that up top, but the Commonwealth Fund is definitely a study that I believe came out in the summer, like very close to our launch of our survey, that did look at the patient experience and coverage issue. And I think I did note that they found that 25% of folks were underinsured. So again, we're kind of seeing this theme around the gaps in coverage, not just with our study, but folks, at Commonwealth Fund 2, KFF also has done a lot of work around deductibles and kind of cost to patients and the pain points that they're feeling within their coverage as well. And then I think the Federal Reserve has been doing a lot of great work around medical debt, especially looking at communities like communities of color in the South, for instance, who face medical debt at really, really alarming rates. So we are seeing a lot of different public polling on this, which is very, like I said, very encouraging that we're somewhat in line with those, and we're kind of going after the same type of goal, and really it's all looking at the gaps in coverage and ways that we could improve the patient experience.
Great. Well, Sharon, you have a comment. I see you ready to talk.
I would just add that, 2 weeks ago, I was in Jackson, Mississippi with one of my government affairs colleagues talking to legislators, and Ipsos reputation is solid. The legislators hear in concise word bites what the 5,000 and more patients have said, which is insurance isn't working, I'm having trouble, help. And that is kind of the call to action, the navigating force to our policies and for their desire to help constituents. So again, kudos to Ipsos for doing such a clear study. Sure, Commonwealth and others have good studies too, but this one really resonated when I go out in the field, and it helps support the policies we are trying to promote that will help patients. So again, thank you, Chris, to you and your staff, and thank you, Cynthia.
Well, I'll pass along that word to everybody. Thank you. And again, let me just be a good time manager here and say, I want to thank you both for participating in the webinar today and kind of sharing this important data, but also providing the context and why it matters out in the public sphere. But thank you. Have a good afternoon, and we appreciate everybody attending.